I told you I was going to give you some things about the school system, and I have someone that I work with who monitors and works with the school boards here in Florida. And she sent me this advanced consent for healthcare services. Can you put that picture up there, Christian? Now, I don't know if you're going to be able to read it on your screen because the words are kind of small, but I will read it to you so that you can know exactly what it says. Now, what this is a form that is filled out by the parent, allegedly to give the school permission to treat a child. Now, this is very, very bad. Okay? This is something, and as I posted this on all my social media, you should never, ever, if your child is still in government school, you should never sign this form. Now, it is very, very interesting. I have gotten several comments on social media about people who have seen this form and they have crossed through it with lines and they've added their own words. Let me tell you something. That doesn't work. Okay? Altering their form is not going to keep them from using the form to do whatever they want. You have to take a big X through the form and refuse to sign it, and then submit a second letter to the school district and to your principal saying that you do not give permission for your school to give medical or psychological care to your child. So let me read you this form. I consent for my child to receive healthcare services provided by the school district and Department of Health providers to promote the physical and emotional well-being and safety of my student while in the care of the school district. I understand, excuse me, I understand that confidentiality between the student and the health provider will be ensured in specific service areas in accordance with the law, and that students will be encouraged to involve their parents or guardians in counseling and medical care decisions. I hope you see the problem with this already. Confidentiality between the student and the healthcare provider? We're talking about children, people. And this form is saying that a parent gives permission to be excluded from the healthcare decisions of their child. That their child can make their own healthcare decisions. Oh, don't worry, the school's going to encourage your child to tell you. But they're not. My initials to each of the following indicate knowledge of the possible services my student may receive from the school district or community partners. School-based medical services may include, but are not limited to, mandated school health services, including screening for vision, hearing, asthma, obesity, scoliosis, tuberculosis, and other medical conditions, first aid, and required and recommended immunizations. You don't want the school doing this for you. They say it's mandated school health services, but it's not mandated to be done at the school. Take your child to your own doctor. Because once the school district gets involved in your health care, they can discover things that need to be addressed and exclude you from them. Medical care and treatment, including evaluation and identification of acute and chronic health conditions, and dispensing prescribed medications. Such services may be related to speech, physical, or occupational therapy and nursing. Behavioral mental health services, including evaluations, diagnosis, treatment, and referrals. Remember, all of this can happen without you. You sign this form, your child will get an evaluation, a diagnosis, and a treatment for any behavioral or mental health issues without you. Health education and counseling for the prevention of risk-taking behaviors such as drug, alcohol, smoking, abuse, sexually transmitted infections, and HIV as age appropriate. What exactly does that mean in today's society as age appropriate? When you got drag queens in G-strings with kindergartners. Do not trust your school to determine what is age appropriate for your child. Services may be provided by school district staff or community partners, like drag queen story time, and may include screening, assessment, and referral, all without you. Emergency health care may be sought if deemed necessary for health and well-being of the above student. Now, again, you should draw a big fat X through this entire form, refuse to sign it, and submit your an entirely separate letter to the school district and to your principal that says, I do not give consent for my child to receive any physical, behavioral, or mental health treatment, period, from this school. They're going to freak out. I had one mother tell me that she already did this and they freaked out. And they said, well, I won't be able to give them a Tylenol or a ice pack for a sports-related injury. Then you just simply tell the nurse, if my child is so sick or so injured that they need your attention, they can be sent home and I will take care of it. Do not give the government schools this authority over your child's physical and mental health. Well, what if it's an emergency and then they won't be able to get treatment if it's an emergency? That is also a lie. States with Good Samaritan laws allow for treatment of emergencies. States without Good Samaritan laws allow for treatment of emergencies. And emergency healthcare personnel and emergency rooms cannot refuse to treat a minor in an emergency situation. So there you have it. You want to protect your child? This could save your child's life. Or do you want the school evaluating the mental health of your child, treating the mental health of your child, prescribing drugs for your child, and never even telling you? Oh, here's a better one. Or they're community partners doing that, and you never even know. This is a blanket consent form for the school to become the parent to the child. And there will be no recourse for you if you sign this form.